I said, this is a study session only and not a town hall style format. And so we are here as commissioners to ask some questions and get some information and knowledge from the health department. And so we appreciate you attending and hear this. And so we'll start the meeting with regard to, Carla, do you have anything that you want to say while we get started?
So in the packet of information that you guys were given, the very first information is just a copy of the application that was submitted to you. So that is on this agenda item. Then the other copy, of course, is just a copy and listing of all of our services. Because you asked a listing, a copy of services, so that's in your packet. Then also in your packet is just a copy of our annual report. So if you want data, and that's last year's annual report, that is from, that is last year's data. That is from, actually, it's 24 data. It was presented to you in May of last year. So you'll get our annual report in May of this year for 2025. So this is, of course, data that is referenced and useful. It'll be a tool that you can utilize if you want additional data on services. And then the last piece of paper is just our monthly report that I provide to you, that I provide to Randy on a monthly basis. So it's just a synopsis of information that was in your packet. So Commissioner Hurst, it's up to you on how you want us to get started or how you want us to go about this. And if you're okay, I can introduce people for the health department. So on my far left is Dr. Loso. Dr. Loso is our medical consultant that takes care of the 65201 obligation for the health department. Karen Hammersmith is our assistant director of clinical services. So Karen is our grant administrator for all of our clinical grants. Megan Gottschalk is our assistant director of population services. And then Megan oversees a lot of those population services. So she oversees preparedness, child care licensing, WIC, and health education. There you go. This is Heather Peterson. Heather is our WIC coordinator. So then you have Candace Davidson. Candace is our health education supervisor. So Candace oversees a lot of our, so you'll see our chronic disease risk reduction grant. She oversees our federal grant, which is our COSIP grant, and our Pathways grant, which is administered through Blue Cross Blue Shield. And then you've got Tammy Depperschmidt and Kelly McClure, and they are our child care licensing specialists. So there's introductions for you, sir.
I just want to also mention that Commissioner Mogner has some family event he had to attend to today, and so he will not be with us for this session. And that is why any decisions regarding the grant will be made when all the commissioners are present, which would be at the March 11th County Commission meeting, the regular scheduled County Commission meeting. So, we all, I'm sure, as much as I do, appreciate the provided information that we have. So we've got a little start on things that we can look through and see which we didn't have before. And that's good to have that in front of us so we can have some questions and make some knowledge, hopefully. So.
Carla, do you want to maybe explain some of, like,
Sure.
as we talked about, a little bit more detail than
Sure.
grants?
On this page, so of course on this page you had a lot of acronyms, and so on this page you had the acronyms like CDRR. So CDRR, and then of course right here, that's our chronic disease risk reduction grant. So it supports evidence-based strategies to reduce chronic disease by addressing tobacco use, physical activity, nutrition, and chronic disease self-management. So any questions on that? That would be under Ms. Candace. So any questions on the CDRR grant, on any services that we provide?
I might mention to those out here that what you see up there, we see in front of us. So if you don't see us, turn around and look. We've already got it in front of us. Okay? Excuse me, Carla, go ahead.
You're fine, you're fine. So any questions on services provided under that CDRR grant? And then also just as we update as we update information on a grant, that will actually be coming at your monthly update that you get every month. I try to highlight on any grants also, so you'll also see on that monthly update, things like the CDRR or pathways or COSIP also outlined on that. So as we progress and provide services specific in the community, you'll have updates on each grant, part of that monthly update that's provided to you. No questions?
You might have to follow the child care licensing a little bit more.
Sure.
I'm at least familiar with some of that, but
Sure.
I work with the state as well as also what counties are involved in that.
Sure. So childcare licensing, that's the second line item on this grant. And of course, that protects children in out-of-state childcare and licensing. And they, in the description for childcare, what they wanted me to highlight is on your big packet. So on this page, that's actually goes a little bit more in depth as far as childcare licensing. It provides a little bit more detail. How do I zoom?
I might ask Carla, when it says second there, and it says 11th and 11th down there, what does that refer to?
Sure. So on this page over here, it also ties back to our community health assessment. So this, on this child care overall, when it tied back to our community health assessment, that was one of the, wasn't the primary concern when our community health assessment, it was the secondary. But it was listed on a top 3 concern when it comes to our community health assessment. So
Kind of a ranking with the healthcare assessment. Is that
correct. So
correct?
on this page, of course, is your ranked concerns. So it actually, that's the third page. It's another page. It ties back to the overall, the health, the schools, and where childcare and some of those issues lie when it ties back to the community health assessment. So it's a lot of information. But again, it's a lot of data I thought might be helpful for you to then tie it back to why we have these grants and why they're priorities in the community.
The grant pays for this
Yes,
totally,
for
Oh,
childcare
totally,
licensing,
yeah.
yes.
and does the state have any involvement in it, KDHE, or do they just basically set guidelines, you follow them, do they help you with this licensing program, or
Sure. I'll let Tammy and Kelly answer that.
how involved are they?
Sure.
Yes, we partner with KDHE, so we're contracted with them, and we cover Harvey and Reno counties, home facilities and centers, and any after-school programs. And so there's a set of regulations that each facility is supposed to follow, and we ensure that they're following those regulations, and we work with KDHE closely when facilities are not compliant with that. And so it's very much a partnership between KDHE and us, as well as us with the facility directors and providers.
Do you want me to move on?
Anybody else have any questions regarding childcare licensing? So,
Okay, so the next one is family planning. So family planning, of course, was the next line item. So we are a returning applicant when it comes to our family planning grant. So it provides access to prevention and reproductive health services, prioritizing low-income and high-risk individuals to improve overall health outcomes. So if any questions on childcare or on family planning will be directed to Ms. Karen. Sure. She's our,
You
yeah,
said carrot,
yeah,
I think you
yeah.
said carrot, yeah.
This is also available at these other providers, right? That you have mentioned here. They can get this service at Hutch Clinic, Summit, Jurista, or
We usually provide the services for low income or no insurance. And so we work as a medical collaborative. And if we can't service them, then we're sending them for the family planning. But we basically, if you have no insurance, you're gonna struggle to get healthcare anywhere. So that's the patients that
So
we service.
if you have no insurance, you can't go to,
Well,
you're
you're
saying
going
that they
to
probably won't accept if you, or give you the care at these facilities without paying.
without paying, yes.
Right.
You'd only recommend people go there, probably with your advice, that's something you can't handle at the health department, is that correct?
Yeah, we have an APRN, so she's able to see quite a few things that any of the STIs, or if they're wanting any kind of birth control, then we go through the different options and that type of stuff and assist them.
And this is totally funded through the grant?
Correct. 80% is about funded through the grant. Family planning requires a match at the county level.
Yeah, okay, 80% to the state and 20% the county.
It's approximate. It's approximate. Of course, it changes every year, but it's approximate 80%, 80 to 90% covered. The other, there isn't, like I said, there has to be a match function by the county as part of this grant funding. It's mandatory, mandated by the grant that there has to be a match by the county.
About what does that usually cost us? Dollar wise?
I don't remember off the top of my head. If you look at it, it's, what is it? It's like 20%, or it's the other 20% of the ask, so. So it'd be whatever 20%, that would be the option. So what, 20, 30,000 that the county then assists with?
Yeah.
If I'm understanding correctly, you can correct me, please, that basically the county is the administrator of this, and we pay the administration fees to handle the grants. Is that a fair statement?
Yes, so the grant helps pay for staff salaries, in other words. Yes, it does pay for staff salaries in administering the grant for Reno County citizens.
So it does pay for it helps pay for the administration fee
Correct.
that we would take in labor and
Yes,
materials.
yes. Do you want me to move on? Okay. So the next one is our IAP. So it's a smaller grant, it's amount, it's 20,000. So, for the immunization action plan, it provides vaccines for residents who are uninsured, underinsured, or covered by state insurance, ensuring children and adults remain protected against preventable disease. Karen, you want to expand on that a little bit more?
We really try to work hard to get our immunization rates up in Reno County. So we work with all the school systems. We work with the Hutchinson Clinic as a collaborative partner. We do their Medicaid clients and also low insured patients. So that we have different populations that don't take insurance out in the community. And so we're able to give those the vaccine for children program, and the vaccine is free to the patient, and then there is an administration fee that we charge for that.
I've got a question. I've got a question. How many patients do you think you see on a calendar year doing these vaccines?
We actually see, I don't have it broken down by how many would just be Medicaid or insured or uninsured, but we see about
While she's calculating that up, I can let you know that in the pediatrics department at Hutchinson Clinic, we have approximately 10,000 patients. 40% of those are covered by Medicaid. The remaining 60% are going to be the bulk of them through private or commercial insurers, but we do have a relatively large self-pay client population. That would include those that do not have insurance at all. Some of our local Amish and Mennonite communities, of course, do not consume a commercial or private insurance product. Then we also have a fairly good sized percentage of folks who participate in some of the MediShare programs as well, and they are not covered as far as vaccine costs are concerned. And it is much less expensive for them to seek care here at the health department than it is for them to attempt to get reimbursement for what could be hundreds of dollars worth at a private clinic.
Yeah.
So
And
I don't have the exact numbers, but just that's where we're coming from as
we see
providers.
about 3,800 patients through the health department in 2025.
On immunization, huh?
Mm-hmm.
Now, of course, I get my immunizations when I go to the doctor. They say, hey, have you had your flu shot? Have you had, so I don't, apparently this immunization is available lots of places.
No, the Vaccine for Children program, the Vaccine for Children program is not available everywhere.
Like
So-
pharmacy or the.
No, It's a specific program. It's a federal program that we have to apply for. And the IAP is a portion of that because then how do you get those immunizations out in the community? So that's what the IAP stands for. The VFC is a portion of that, and that's Vaccine for Children. And it came about in the 70s to make sure that we have equality, so it wasn't just your kids with insurance getting vaccines, because they could see that they had low income and people without insurance weren't accessing healthcare, and that's who was coming down with the diseases. So that's why the federal government came out with that, so that the equity would be there for anybody that didn't have insurance.
And this program's funded completely through this grant, or do we kick in on that also?
No,
Well, the product is supplied through the federal government, through the Vaccines for Children program. So if I
The
remember
vaccine
correctly,
themselves is not part of that,
is not part of
the 20,000.
So the actual medications and substances that are used to immunize the children do not cost the county or come out of this grant whatsoever. It comes directly from the federal government.
It does not count, does not cost the
does not
county
count.
health department.
It would be a touch more on the cost side if that were the case.
so this grant covers staff time to go out and administer those vaccines. Yes,
It covers
100%.
that also.
Yes, yes.
Pharmacies are restricted, differing state by state as to what ages that they can provide immunizations. So some pharmacies in the state may participate in the VFC or Vaccines for Children program, but they are limited and can only give injections down to age 12. So there's been some, attempt with at least my professional organization through Kansas chapter of the AAP and attempting to see if we could get that dropped to age 6 in some instances, but so far that's been unsuccessful. I don't know, 6-year-olds can be pretty feisty, so a pharmacist may not be quite prepared to handle some of the folks that we all have to handle sometimes in the office. But these vaccines are not available at my office because our office is not, and I could be happy to talk to you about some of the fine details of that, but we have not at the Hutchinson Clinic has not ever been a participant in the VFC program. So 40% of my patients cannot receive their immunizations at the clinic. They cannot. I mean, if they did, they would get charged. So, and that is exorbitant, especially for your patient population and the demographics that tend to be our patrons of our Medicaid program. So they cannot get them at the pharmacy, they cannot get them at the office. So our health department is our major provider and an absolute blessing to us in our department. And I personally don't know how my practice would function without them.
These vaccines for these children, are they still required for children to have certain vaccines to go to school?
Yes.
And these are part of that.
Mm-hmm.
Thank you, Doctor.
Yep.
I would say in 3 years is the first time I've been sitting on one of these because I wanted an informational that I've explained that to me. So,
As far as the participation is concerned? Yeah.
What you just said, I appreciate what you had.
Oh, no problem.
Very good.
It's nice to have the facts and stuff.
Okay, let me continue on.
Yep.
Okay.
Go right ahead. Nobody
Okay.
says anything, you go right ahead.
So the next one is maternal child health. So maternal child health is this application. So maternal child health, that supports our healthy pregnancies, healthy births, and early childhood development, including services for children with special health care needs, ensuring families with the support needed for a healthy start. So again, any questions would go to Ms. Karen.
This isn't anything to do with budgetary items, but at what point, say, in any of these instances, say like in childbearing, at what point, if you can't handle that particular patient for one reason or another, is Dr. Loso involved in the conversation about having to get care outside of here? 'Cause I know that happens occasionally.
Yeah, Dr. Loso is a pediatrician, so no on that instance. But we do have a collaborating physician that works with us, and it's Dr. Jimenez. She has been at the Hutch Regional Medical Center now for, I think she started in September. I think she just started in September. Yeah. And anyhow, she is our collaborating physician. We have an APRN. She sees the patients and we do pregnancy tests and then get them in their program, or we help them to get insurance. And then some of them stay with us if they're uninsured. And Dr. Jimenez will come once a month. If they're high risk, we will refer to Dr. Jimenez and see what she wants to do. There is a high risk physician that the Hutch Hospital and the MCH Collaborative, which includes the Hutch Clinic and Prairie Star, have all gotten Dr. Wolf to come, which is a maternal fetal medicine physician. So we're very excited about that. So he's going to see patients on Fridays at Hutch Regional Medical Center, and our patients that are high risk can go there without the difficulty of driving to Wichita.
It was like Republic information. I wanted you to state that. I was really thinking.
Yeah.
If I may, gentlemen, I'd like to just illustrate one point where sometimes us as pediatricians, we do get involved in assistance of the care of a maternal child dyad, which, at birth or immediately prior to birth. We had a situation in the somewhat near past where, just as an example, maybe, we have a child born to a mother who is positive for a particular infectious disease. We mentioned the family planning section earlier, and sexually transmitted infection testing and treatment is a very big part of that. And so sometimes it may seem that these things may overlap, but these staff do a great job of figuring out which pot of pennies this is going to come out of. But it sometimes can seem to overlap. For example, a particular infection could be very, very devastating to the newborn if not treated appropriately during pregnancy. We have had a relatively high incidence in the rate of syphilis in our community in the last year or two. And that is a devastating devastating to infants and newborns if they are born to a mother who has not received adequate treatment. It's also incredibly complex to make sure that you get accurate testing because there's different types of tests. And so to make sure that, did they get the appropriate treatment? There's big algorithms that we have to look at. And so they may communicate with the physician on call at Hutch Regional as far as pediatrics is concerned, or if they are aware who the baby's pediatrician is going to be, then they may contact us ahead of time. So it may seem like some of these areas overlap a little bit. We do sometimes get involved in our own individual cases, but as far as like overall maternal health, I'm just here to help consult in general on that, but not for specific cases. However, we did have several, Carla and you and I, we had several different kind of ongoing, information things about trying to figure out to make sure that this child was not going to require further testing or treatment and things like that. So we do sometimes have to get involved, but it sometimes gets messy, but I feel like our physicians and providers do a wonderful job, and the staff at the health department communicate with us fantastic.
Okay. Next one is our public health emergency preparedness grant. So of course, that amount, that line item is right here. So, so for that grant, that strengthens Reno County's ability to prepare for and respond to public health emergencies. As recommended by you guys, we are going to partner with the emergency management staff to fulfill preparedness and response requirements. So we did have a preparedness coordinator, and based upon your recommendations, that position is being dissolved, and Megan will oversee the implementation of this. This is this grant specific to local health departments. So local health departments it has to be placed at a local health department, and then we will work with emergency management and Adam's staff in administering this grant. So if you have any questions on that grant, and we'll go to Ms. Megan.
That's just like that's an emergency, like, that's used to COVID, for example. And that's strictly what it's for.
So it's our general, I'll let you respond, sorry.
You're doing fine. So public health emergency preparedness is a grant that supports emergency preparedness when it comes to public health emergencies, similar to COVID, or it could be a sexually transmitted infection that we might have over the threshold of what might be required. And so then we would have a community response. How do we support those families in our community who are experiencing that, and also prevent it from other families?
Well, and I know for a fact that you guys, it's been a few years back, but you had a case out of Sonic,
Yes.
and it was over 300 people. But you isolated and found everybody, and did a wonderful job in getting that taken care of so that it didn't spread any further than those 300 people.
Yes, that's true. It's always nice to be able to know your partners before emergencies happen, and that's what the Dept grant does and supports.
That was the year before I came to town. That was approximately 2002.
Yes,
So
it's been a long time.
just been a couple weeks.
Yeah, well, I always tell people, what I think was a year ago was probably 10.
Okay, the next one is state formula. So the state formula is, this is a grant that is provided to us by KDHE based upon the population of Reno County. So this is a funding amount. So this dollar amount comes to Reno County, and it is for what we need. So what we utilize the state formula funding for is to cover our administrative functions that are not covered by other grants. So that's what we utilize the state formula funding for. So we can try to fund, usually your administrative funding, your administrative positions are not grant funded. Usually they take care of like the clinical part. So there's always administrative money that we need. So it's nice to have this additional money so we're able to utilize that money to cover some staff time.
Carla, is this the one that if, based on our mill levy, the formula is based on how much
Correct,
of a mill levy the county puts in
correct,
impacts this number? So the
Correct.
less we put in, the less
correct,
this grant goes down.
correct. This grant does go down based upon what goes
So
in.
The
comes from
lower
you
the
guys.
mill levy, the lower the grant
The
money.
assistance.
Correct, yes. Then the last one is this universal home visiting. So this was typically covered under our MCH program. So again, that's our maternal child health. And so I'll let Karen go ahead and expand.
So the home visiting is really a person going out into the home of our maternal child health clients and making sure that they're going into a safe environment. So we work very closely with the pediatricians at the Hutch Clinic and at Prairie Star. And if they have anybody that they feel like might be going into a home that's unstable, they will send us out there to check on them, make sure that they have a safe sleep environment, make sure that there's nothing that's going to be like substance misuse or anything like that around that child. So it's really kind of a welfare check. But we also, the universal home visiting comes with the maternal child health, and that we have planned visits so that we just continue to get that education as well. So a lot of those clients are patients that she would love to spend 3 hours educating that patient, but she doesn't
Okay,
have time.
maybe not.
But she doesn't have time. So our maternal child health nurse goes out there and goes over all the different milestones that they need to be meeting. Make sure that they do know how to give them a bath, know how to feed them, breastfeeding support, all of those things that go in with just having a baby and making sure that they're off to a really good start.
And a lot of these families are people who maybe have had a call in to DCF for different things and maybe a high-risk situation. But in attempting to try to keep a nuclear family together and to see if we can help support the parents, they can receive assistance in teaching and education so that we can also try to help keep the child with the family and try to prevent them from ending up in a foster care situation. Maybe they are high risk from an illness. Maybe they were premature. Maybe there's, different things like that. We need a weight check. And it's safer to do a home visit for a tiny baby that just graduated out of a neonatal intensive care unit that weighed 1 pound at birth than it is to bring them into my office in the middle of January during RSV and influenza. And so it's a broad range of different reasons why, someone at our office may need help with that. Or maybe it's just somebody we're worried about. Maybe they didn't show up for a visit or, and it's not enough to call out the sheriff's office for a welfare check, but, maybe it could be a way that we could help out, or honestly, maybe I am concerned. Maybe we do need DCF, but I can't get, this is a way to get boots on the ground, so to speak, to see the actual environment, because I can't see what's necessarily going on, but I can utilize the providers that go out to the home for a myriad of different purposes but most of all, to try to help just support that family so that they can have that child grow up and thrive.
So you're kind of doing the check, and if there is a problem, then you go to DCF.
Or us, or
The clinic, depending on.
police, or whomever is the appropriate.
Commissioner Parks, I know at the last commission meeting, you wanted me to address to double check as far as duplication of services. So I did reach out to Ben at the hospital. I did reach out to Matt Leary at Hutch Clinic, and Brian Anderson at Prairie Star, and then Vicki at Horizons. Just to touch base with them, to make sure that if they had any concerns about the services that we were provided, and to make sure that we were not duplicating or any services that they thought that we were. And I had they were very much in support of the services that we're providing and said, no, there's absolutely not a duplication of services. Again, like Megan talked about, it's nice for us to touch base with our medical collaborative individuals to make sure that they know us and we know them. So if there's any concerns, I can reach out to them, they can reach out to us, so we can try to address concerns. So if there's any services that we think or might be a duplication, that we address that at the time. So we try to avoid that. So that was the goal. And
Or even something that we're not getting that we need to look at.
True. And again, we try to touch base at least once a year, or if there's an emerging health issue that we need to get together on, we do call a meeting and we get together to kind of talk about that. Or otherwise, if there's a one-off, then we'll try to touch base with each other to try to discuss that and see if there's any connections or any meetings that we need to have.
The duplication that I thought about was like, when I could get my vaccine at the clinic or my doctor's office, and I go to the health department and get it. Still costs me nothing. So the convenience factor is we're not going to see the doctor, just get the shot.
Mhm.
So I was kind of wondering if that's a duplication of service that someone else would provide if we didn't provide it.
Right, but I think, did you clearly understand that they said that there is not a duplication? There are services that Hutch Clinic provides,
Uh-huh.
and there's services that we provide, but there's not a duplication, because some of the services that we provide, they can't receive at Hutch Clinic.
They don't, I don't understand that.
Correct.
Like
Correct.
for just general vaccines yearly.
But they're talking about children vaccines.
Yeah,
I
children
mean, I can
vaccine,
get
I
mine
see
anywhere,
that,
but
yeah.
I go to the health department.
I see
Correct.
that, yeah.
I've had
Correct.
mine done
Or
there.
or you can, I mean, if you have regular insurance, sure, I mean, you can get yours at the doctor's office anytime with your doctor.
I have a few patients with Blue Cross Blue Shield that like to go to the health department to get their children's vaccine.
And they.
And it comes out of a different stock. It's not the same stock that those with Medicaid receive. That's very clearly separated as part of the program.
And then they pay for the administration fee, the insurance, or
The insurance.
Yes, we do bill
basically,
insurance.
what- same way
Right, right.
I operate, I guess.
Right, correct. Correct.
I mean, I've received a ton of emails since we decided to have this meeting. And I know for a fact, just from living here since 1973, but the health department and other health organizations, you guys have a bridge to everybody. And it's not like you're out here on an island, and they're not on an island either. And if we don't have certain services provided, then it's great that you guys do provide it. And like I said, I have insurance, but I've come to the health department for 25 years to get my vaccines. So that doesn't mean I couldn't go to my doctor, but I just enjoy coming here. You guys do a great job. I've never had anything but positive feedback from any of the people. I got bit by a spider one time. My wife made me come to the health department so a nurse could look at it before I did anything else. And so from what I see and from visiting with people that use the services, low income to even people that don't necessarily have to go there, but they like going there. You guys are doing a good job, to me, in my point of view.
Social media, I mean, it's great, but this one got out of hand. I mean, it hit like this, and it wasn't. I mean, it wasn't. And my opinion is that this is helpful, and even on down the line, because if we have a shortfall on our budget and we're asked to make cuts, then we already have information. So, and be honest with you, when it comes budget time and make cuts, they don't give us much time to do the research. And I think this is what we needed to look at.
Carla, can you have Candace mention some of the education? We've talked a lot about the medical side, but I know your department does a lot on education that's very important that doesn't have duplication at all.
Yeah, so the chronic disease risk reduction grant, which is the part with the KDHE with this aid to local, is geared towards making sure that everyone in the community has access to the knowledge to help them not have a chronic disease, right? So that includes anything with tobacco use, or lack thereof, right? Helping youth and pregnant moms is what we've really been focusing on this year with stopping vaping and smoking. Nutrition is also a big part of this grant as well. And hopefully you all have seen and maybe been to a few of our events in the last year. We've really hit hard on food insecurity. That's been a big part of what we've done with the CDRR this year, is really making sure to bolster what's happening in the community. The food bank is opening up a new location here really close, and it's going to be a lot bigger and a whole lot more exciting. So being able to work with that group to make sure that we have access to fresh food for everyone is really important to us through the CDRR grant. We then also talked a lot about elimination exposure to secondhand smoke. So we actually are able to work with these guys and work with our childcare facilities, making sure that they are not only smoke-free, vape-free when they're open, but also when they're closed. And that the people, especially home healthcare or home childcare facilities, and people that work at the facilities are not just going outside and smoking and coming back in and bringing all of that with them. So really, education is a lot of what we do through CDRR, just out in the community, helping people understand how what they're doing now is affecting their future, and really working with that chronic disease part of it. So for just CDR specifically, that's what we do for the education part of it.
Candace, could you mention about Reno Valley and how sometimes outside organizations reach out to you for things like
Yeah.
that?
Of course, yeah. So we have worked really closely with Reno Valley. That is one of the schools that we've worked with really closely. They have a big champion in their principal, Vince Nacarado, and he has worked really hard at making sure that when kids get caught with a vape, that it's not punitive, that they're actually learning from that mistake instead of just immediately going and getting fined and getting kicked out of school, and so then they can go home and vape, right? That's what they're gonna do. So we try and really make sure that, so he's been a real big advocate to make sure that when kids get caught vaping at Reno Valley, they have an education component. So they sit in a room with either the principal or the counselor, and they do a video. It's an interactive video that kind of walks through the cons and how vaping, how big tobacco is really targeted towards them, and really helping them to learn how to quit vaping, and giving them the skills to make good decisions as well, not just on tobacco, but those whole decision-making skills as a middle schooler is really important, to learn that young. So working with Vince and Reno Valley has been really great. They have a policy in place now, and like I said, he's been a real champion throughout the entire state. Actually, he's been asked to speak at several different big conferences to talk about all of the great things that they've seen. They actually their vaping rate has decreased dramatically in the last year. So.
At one time, the health department was involved with some community gardens as well as the farmer's market.
Yes.
And you've had some volunteers with regarding food distribution and food needs.
Yes. So we've had our hands on a lot of different things. Part of that is actually through the Pathways to Healthy Initiative grant that we've done. So the farmers market was a part of that grant that we really worked at making sure that people knew that it was here, that it was available. It's another great place to go get fresh foods and vegetables. They also were able to start the double up food bucks there. So if anybody that has SNAP comes in, they actually get double the dollar on it when they buy fresh fruits or vegetables from any of the vendors. So that's a great asset for our low income families to be able to do that, come in and utilize that facility to get extra fruits and vegetables into their diet at a low cost for them. And then we also, so Pathways also helped with the data walk as well as our food report that we just put out 2 years ago. This year, what we've really been focusing on is our senior population and trying to make sure that they have access to SNAP, and that it's not just for families, that it's for anyone and everyone. And if you are at a lower income, doesn't matter your age, that money is there for you, and so that you can utilize those funds.
Well, the Double Up program has been a successful program.
Yes, it's been very successful. So, yeah.
Quite frankly, I'll be a little editorial here, but if we could get the state and the feds to make SNAP a little more useful to producers, it would certainly help. Because it's a very cumbersome, very long, hard process. It makes sounds so great when you go into the video and the Zoom program about it, but it's in reality it's a long ways from being that. But it's still a good program if you want to participate.
Yes, yeah, it's very helpful for our families. So that's been the other, we have been able to work with WIC as well on helping pregnant mamas stop smoking and really being able to see how WIC is utilized in that, and making sure that population also has not just WIC and SNAP, but also the access to the smoking cessation things that are available.
That's all the items, sir.
If I could add one more comment, gentlemen, there's quite a bit of research across the nation that demonstrates that communities that have robust and well-functioning community county health departments have better overall health rates for the community as a whole, including the populace that does not frequent the health department or who does not directly receive their services. So it is definitely a rising water lifts all boats type of a situation. So having a robust and well-funded county health department, because we do provide so many different services, not just to Hutchinson, our entire county, but also to several of the regions around us, it is definitely a way to help boost just our community health as a whole, even for those who don't have to ever set foot on the property, so.
Well, I appreciate it because it's a great refresher when we do this every year. I know you've utilized the service over the years, but I thought for the new year and for new commissioners, it would be a good thing for you to come present this. Is primarily why I want to pull it. But knowing that in the future, the uncertainty of what's going to happen in Topeka and with grants and stuff, it's always good to look ahead. You don't know what would happen in the future. They're trying to make drastic cuts up there too, and so things could happen. It's good for us to be aware of what's going on because we either have to be a stopgap or look at some really hard decisions if something like that happened. And I think if we're informed, that's a better way to do it than to just say blindly, we don't need this, because I don't think that was the intent of this at all. And I have to agree with Commissioner Benson. This got blown completely out of proportion by somebody or somebodies, and it should have never happened because it was never had the intent of maliciously shutting down a health department. I don't think there's anyone on this board would feel that way. And I know I've received lots and lots of emails and texts and different things, and even phone calls, and I've talked to people. So I couldn't reach out to everybody. So I say that today that you can't ever get to everybody, but that, of course, that's just not the intent of this. And so what we have today, what we did here, that was the intent. To be well informed going into it, and it is a weird timing, and it's tough when you do budget. We're trying to do this by March, and we've got a budget in June, July, and try to get a budget put together. Should there be something that needed to be looked at, that's the intent to look at it too, because we can't do anything after the grants are passed. But the intent wasn't to take those away, so that's the way it's going. I'm concerned for the future, and I'll share this with this group here today. I've had some concern for the future with those that are regulating and legislating, that they don't fully understand the day-to-day of the county or the city. And sometimes they make decisions up there that are not the best informed decisions. It seems to me like sometimes when they make decisions, it has an impact on us that's good, but sometimes negative. And that can happen very, very easily. And if we understand what's going on here, maybe we can address them more easily. I've had conversations. In fact, I'm headed to Topeka myself Thursday to roam around and have some conversations while I'm up there on this very subject. I wish you'd be more informed of the day-to-day workings of the county, and you'd be more open to what our needs are, and instead of trying to legislate, hamstring our budgets and do things like that. You don't know. I said this in the meeting, and I'm going to say this before the group that's here today. We had a meeting, all except for one of those legislators that was with us. And I think I kind of surprised my fellow commissioners when I asked how many of you actually led anything locally. And I didn't get a show of hands. And it was very depressing for me, the fact that when you're going to try to create laws and regulations, that you don't know what all of you do, or what we have to go through, what the administrator does day to day, and how we have to try to go into budget sessions and figure out how to make the next year without making the public enraged because their taxes are going up. Don't believe me, they can get that. And so this is the reason I think information is crucial. There's some here going to leave here today that didn't fully know, I'm sure, everything that you said today, and that needs to be known. So that we have some support, both one way or the other. That's my reasoning for this today. So
We want to add a little bit more to what you said. The state legislature just recently passed a bill that limits our ability as far as mill levy is concerned. And it's 3%. Now, my numbers may be a little off here because but I just figured out that means that we're limited to about 0.49 something like that, a little less than a half of bill that we could raise. Now, none of us want to raise it because we all pay taxes too. But if our insurance goes up 10 to 20% a year, asphalt goes up $5-10 a ton or more, then we're gonna be, I think we're gonna be, speaking for myself anyway, the other commissioners can chirp in here, but, we're gonna be asking directors to look when they come present a budget for their departments on the absolute needs of that department to the best of their ability to be able to function and provide the services you all need. Maybe not all of them you want, but all of them you need. And we've got that decision to make. And so the more information we can have, just like this, if we'd have had this before, we would have been much better prepared. And so that's the kind of information that we're seeking, and this is good. And I just wanted to let everybody know that the next year and 2 years to maintain employees, qualified employees, it's gonna be difficult. We're seeing nurses up here, ERAs and whatever else that goes with that would have some certification. And they have a job description and they need paid for that. And so anyway, that's just off my soapbox, and anybody else think that, because we're really many times hemmed in by what the state does to the local governments. That's not just county, that's city also.
We are, and I truly appreciate the job everyone in the county does. I've said that many, many times. I had the opportunity to go to an uncoupling and you know, the fire department was out while they were trying to do a ceremony. Half of them were out fighting a fire. That's what they do. You hope you build a building like that and never use it, but you have to. And so everybody does a job. But, you know, for us, sometimes we get flack, but we sometimes don't sleep at night thinking about how do we maintain the employment and try to keep taxes down. And it's not an easy task. It's not taken lightly at all. But if we don't look at every avenue before something could happen, we're an ostrich with our head in the sand, and I think that's the wrong way to live. So that's why we're here today, to look at all these things as well. So.
Well, we had a meeting with 17 of the directors 2 Fridays ago, I think. And I had a suggestion, which this is part of it, is, you know, we have 17 departments plus, and if you don't need that department, you don't think about that department. But they cover a wide range of needs in the community. And my thing was that we need more information to go to the community, because we have all of Reno County, which has not just Hutchinson, but all these other little towns and townships and things. And if you don't know that service is available, and you just look at our budget, you go, what is this? You know, why are you spending this? It's hard to justify it if a person doesn't need that service, but if they do and they realize it's there, then we want them to utilize it if they can. I know we didn't talk about it, but Department of Aging, you guys do a lot of stuff for older folks that can't afford to go to their, you know, hospital or clinic, where you take care of foot clinics for people with diabetes and things like that. So, but anyway, so this is very helpful, having this information, having everyone at these 2 tables, and letting the people that are in Reno County know what the health department does. It's not, you don't just go there to get a shot. I mean, there are a lot of other things that you guys do that, when it comes to Reno County, is very useful and very beneficial to the county. And like he was saying we don't sleep at night, some nights wondering, you know, if the economy does take a downturn, how we're gonna, to get the services that the people in Reno County need. Maybe, you know, if we do have to make a cut here and there, is it gonna really affect, you know, somebody that's in that need? So that being said, I do appreciate everybody in the audience, but also you ladies here today that have given us this information. And, you know, I wanna take it from here and grow and make Reno County the best it can be.
Well, this is, I mean, again, come budget time, call it a budget, but, you raise the mill levy to cover your shortfall. And, you know, try to keep, I really want to keep away from that again this year, not raise your property tax. Because we missed our budget, which I guess is, you know, you call it a budget, but, I want to keep away from that. But when it comes to where we're going to get this money at, what we have to cut, things like this is very important because you see where it's going, you know where it's going, and you know, when it comes to budget time, I feel like we're really cramped for time to get something done, and so the more we get done before that, it's just going to be easier to make these decisions. I feel, and I feel it's very helpful. Again, like Mr. Park said, if it wasn't malicious or anything like that, I kind of see it as being proactive.
When we look at ROI, we all need to look at ROI. It's not just money at the present time. Your return on investment sometimes includes a couple or 3 years down the line. And it doesn't just include money. It includes welfare, and I'm not talking about money, welfare, I'm talking about human welfare. Thank you all for attending. Anybody else have any questions or comments? Thank you.
Thank you
Thank
again.
you, Health Department.
Thank you.